And this training will be hosted on our HAI webpage once we get everything cleared and we can put it up. So hopefully within the next week or two, that will be up on our HAI webpage for those who are unable to attend. So our presenters today are Dr. Mark Pandori and William Bendick. Dr. Mark Pandori has a BS in genetics. He has a PhD in biomedical sciences, and his postdoc was at Harvard Medical School. He is a certified public health microbiologist, board certified molecular diagnostic, high complexity laboratory director, chief microbiologist and laboratory director at San Francisco Department of Public Health Laboratory. He was the director at Alameda County Public Health Laboratory and is currently the director for Nevada State Public Health Laboratory. He also is an associate professor, getting tongue-tied this morning, of microbiology, immunology, pathology, and laboratory medicine at the University of Nevada, Reno School of Medicine. William Bendick is the current laboratory manager for the Southern Nevada Public Health Laboratory, and received his education and master's in public health at the University of Nevada, Reno, and a Bachelor of Science in Clinical Laboratory Sciences at the University of Nevada, Las Vegas. Dr. Pandori, the floor is yours.
Great. Can you hear me, Kamisha?
Yes.
Okay, great. Well, thank you for the opportunity to speak to everyone today. I really appreciate the opportunity to have such a large and esteemed audience. Kamisha informed me that the primary goal was to provide some training for specimen submission and acquisition of services at the State Public Health Laboratory today. But I thought because I had such a big audience, it would be an opportunity to go over and review some of the states or all of the state's laboratory services and to give some updates on some current topics of interest to all of us. And this will be something we'll go over prior to getting into the more educational or training aspect to the talk today. So really what I want our goals here over the next hour to be is I want to talk about what services the state lab does provide. And then we'll go over some topics of interest, some hot topics like monkeypox and what's going on with SARS and a few other things going on in the state briefly, rapidly. And then we'll advance into the more training part of the talk today where we talk about submitting specimens, how to get them to the state lab, and also the Southern Nevada Public Health Laboratory, which is on the call with us. And then at the very end, I'll close by giving an idea of where we're going with some updates and some additional services that the state lab will provide in the near and far future. First of all, I don't know who's on the call and who isn't, so I thought I would introduce the State Public Health Lab or reintroduce it to all of you, and that is to say that we are the State Public Health Lab for Nevada. We are on the campus of the University of Nevada, Reno School of Medicine, where we are administratively operated. The State Public Health Lab serves the entire state, obviously. It serves all 4 health districts and provides laboratory services of biosafety levels 1 through 3. Our highest volume testing is newborn screening. We also do environmental and chemical testing. These are 2 things that really distinguish us from a general clinical laboratory. We do a very, very large, almost limitless menu of infectious disease testing, and now also quite a lot of what we call genomics, which I'll talk about in a bit. In terms of the services that we provide to the state, they would include clinical diagnostic microbiology, as I said. That includes, which I left out of the previous slide, select agents. So the State Public Health Lab is one of what's called the laboratory in the Laboratory Response Network, which is to say that we can respond to agents of bioterror, but also chemical terror. And that's a designation provided by CDC with a set of assays and trainings and skills and procedures to deal with such things. What I'll go over first or very quickly are our clinical microbiology and immunology services. We do provide a wide range of STD testing. We do extensive mycobacteriology and mycology work. Our serology includes hepatitis and HIV and also syphilis serology. We do direct detection of pathogens by PCR, but we also do parasitology that includes malaria. We are a reference lab for bacteriology, which is to say we can identify virtually any bacteria either by biochemicals, mass spec, or now genomics as well. And now we do offer services in the realm of what we call next generation DNA sequencing, sometimes referred to as whole genome sequencing. And I'll just touch on that a little bit as that's something that's really coming on strong in the realm of public health. With regard to select agents, we can cover anything that's been historically weaponized or by intelligence reports have been considered to have been weaponized by other countries or our own. And that would include smallpox, anthrax, Francisella tularemia, and plague, also known as Yersinia pestis. It's important to recognize that we have hemorrhagic fevers as well, not only globally, such as Ebola virus, and now we have another outbreak of Ebola going on in Africa as we speak. But we also have local hemorrhagic fevers, such as hantavirus, and we do see a couple of cases of that every year, and something that we all should really be on the lookout for. Our highest volume testing here at the state lab is in newborn screening. And with regard to newborn screening, this can amount to almost 500,000 tests per year. This would include inherent disorders. Babies get tested within 7 days of birth by law in Nevada, and that would include amino acid disorders that we test for, fatty acid oxidation, organic acid, metabolic disorders, endocrine disorders. Overall, it's about 55 total disorders that are looked at in each infant. And that's about 35,000 babies born in Nevada each year, for those of you that wonder how many babies are born in Nevada every year. And again, really this
better than nothing.
This includes galactosemias, hemoglobin, cystic fibrosis, SCID, this is the lack of an immune system, and biotinidase. These are important disorders to test for because with newborn screening, there's really action. These lab results are extraordinarily actionable. So it's really a very large part of what we do here, and our response can really make a significant impact on changing the life of somebody. If these metabolic disorders, inherent disorders, are missed early in a baby's life, you miss a profound opportunity to give that person a normal life. And so I wanted just to remind everybody of the importance of that program and what it means to quality of life. And the other thing that distinguishes the state public health lab from a lot of your laboratories is that we are allowed also to test non-human specimens, and that includes environmental testing, and largely that includes water. We can test drinking water, natural waters, wastewaters are now a big part of our program since COVID. We screen wastewaters for various pathogens. This would include total and fecal coliforms, which would be indicators of fecal contamination in water. We also test for Enterococcus, gram-positive fecal contamination indicators as well. But we're not limited to biology in water. We also do quite a lot of water chemistry, and this is over 40 analytes, including metals, which can be toxic at certain levels in water, complex toxins, nitrates and nitrites, and also just look at general quality of water. So we accept submissions rather broadly and can test very broadly with regard to water quality. We also do research at the Public Health Lab. Right now, we have interest in areas such as tracking drug resistance and gonorrhea. We're very interested in multi-drug resistant healthcare acquired infections. These would be like CRE, or as we'll talk about, Candida auris, and of course tuberculosis, where we're trying to develop systems to track and detect drug resistance more rapidly genomically to try and save turnaround time. We're also very involved right now, and I'll talk more about this, with Candida auris, because we're having a large outbreak in Nevada right now. I'll go into that. And we also have public health research going on and trying to ascertain what we call a molecular clock in that organism, which is to say, given the relative newness of this organism to public health, we still have a lot to learn in terms of how it evolves, how rapidly this organism evolves during outbreaks. And we're trying to use the genomic data that we get not only from a public health and medical infection control perspective, but we're also trying to harness information from these outbreaks to try and learn a little bit more about how that organism responds genomically as it evolves during an outbreak. And that requires whole genome sequencing, which is another function here at the lab that lives right now in the quasi-diagnostic realm. We are in the process of validating these, but right now they're valuable tools in the surveillance realm, which is to say for epidemiologists and disease control investigators and for infection control professionals at your facilities. We can use whole genome sequencing to ascertain relatedness of organisms. So by looking at bacteria, or in this case, as I'll talk about, Candida auris, or in the case of SARS, a virus, we can look at the sequence of the genomes of these things and describe back to you or to public health officials how related cases are. That can provide valuable public health intelligence because it can aid in ascertaining whether a cluster is an actual outbreak or to rule out a cluster as not an outbreak, which can be just as useful because you're not wasting resources in looking at coincidences. The other thing sequencing can do from a reference lab perspective, from a public health perspective, and a medical perspective is to really describe pathogens. And I think from a diagnostic perspective, we're going to, over the next few years, leave the diagnostic realm as those tests become more and more moderate and low or waved complexity. I think testing at public health labs will become more about gathering information about infectious agents. And that would be things like drug resistance or strain type or virulence, all of which are genomic traits that something like sequencing can determine. And so I think we're going to have an exciting dimension that we're going to enter in public health and in medical science as we start to look at diagnostics through that descriptive lens more than just a Boolean positive and negative lens, as we often do. Genomic sequencing, as I said, can aid in cluster detection. So if you have a cluster and they're related, it can give you a clue that there is an outbreak occurring. It can clarify whether cases are coincident or not, or a true outbreak, as I said in the previous slide. But it can also find sources. So, if you had like out in the wild, as an example, of course, there's probably plenty of good hospital examples, but out in the wild, you might say, well, if you have cases of a bacterial infection in patients, but you find it in food, or if you find it at a water source, you can very easily connect the cause of an outbreak and the cause of the spread of an organism. And that can be very valuable for preventing further cases. And I think we can all imagine how that might function from an infection control aspect as well. It can also tell you how long something's been going on. So if you have an outbreak that's been continuing, you can look at the genomics. And this is why I'm very interested, I think, in the Candida auris molecular clock, because with bacteria, you can look at how many mutations occur over time by genomics, but you can also then use that to say, how long has this outbreak really been going on for? Right now, we offer these services for carbapenem-resistant bacteria that are out there. Those are coming to the lab, and we're sequencing all of them. Our enterics through a CDC program have been sequenced for years, and that continues. SARS-CoV-2 is also being sequenced here, and certain people used this, certain disease control investigators used that data during the meat of that outbreak to really look at cases and case spread and transmission networks. But now being very heavily applied to Candida auris because Nevada is having a real experience with it. But it's not just a matter of us sequencing these organisms for you out there. We can also train, partner, and walk through with you how to interpret this kind of data, how to visualize it, and what it means operationally for you. So just something to throw out there as a kind of new service that we really would like to try and utilize for public health and medical science, but also we can train you on how to use it and understand it. Leaving the part of our talk that talks about our services and going into some hot topics before we get into the training part of this, I think there's a little curiosity out there about monkeypox, and I'll say that right now, as of a couple of days ago, there were about 25,000 cases in the United States. In Nevada here, we've had As of that day, 218 cases. About 98% of the cases have been seen in men who have sex with men worldwide. Some of the other things that we have been seen that have been mistaken include syphilitic lesions, herpes, other herpes virus lesions, and in children, enterovirus. It's interesting because the cases are falling. They've fallen about 40% since August. Testing is available at the State Public Health Lab. I don't expect you all to write that down. That's the link to our clinical testing menu at the Nevada State Public Health Lab. You can find that by Googling Nevada State Public Health Lab and looking at the front page and going to the far right. It's very easy to find, but just to put the link there to say to you that you can find all of the collection instructions and specimen instructions for monkeypox testing there. Our test is an orthopox PCR, so it would be positive in the case of some other orthopox viruses in addition to monkeypox. So we still send those positives to CDC to make absolutely certain that they are monkeypox. Anecdotally, talking and hearing, being in meetings with lab directors nationwide, not a single orthopox PCR that's come up in the last few months has been anything but monkeypox. So although your test report would say presumptively positive, it would be rather considerable assurance to you that you have a monkeypox case if you were to see that on your lab report. Sorry, my intercom's going off here. The preferred specimen is a swab and viral transport medium. We'll accept dried scabs, lesion biopsies, and the unroofing, which has been a controversial topic. There's been a lot of anecdotal evidence that just swabbing the lesion at the top of the bump itself, as CDC's been saying, can result in false negatives, and that lancing or unroofing can create a true positive case. Don't have hard data to show you on that, but wanted to let everyone know that would be something acceptable. Results are the same day that we get them if we get them prior to about 1 p.m., but they would be overnight if they came in after that. And again, our website for collecting specimens for that. SARS-CoV-2, I almost hesitate to call a hot topic, but I think we need to keep our finger on its pulse. There's plenty of testing available. A reminder that the test that we offer is a multiplex with influenza A and B at the state lab. We're still getting a fair, decent amount of specimens, but nothing like at the height of the pandemic. The positivity rate remains quite high, and there's quite a lot of local outbreaks going on all around the country. We continue to sequence as many positives as we can, and I'll tell you what the results of that have been in the next slide. But if you ever had variants questions or lineage questions about submissions, there's a good chance we'll be able to provide you with genomic data on that if it's in the batch that we've sequenced. We have a website which we've been tracking and allowing you to go to look at the genomics. It's currently down, and we're working to get that back up. But it's a site that generally allows you to go in and look at by county and date what the genomics are of the SARS-CoV-2. And when I say genomics, I'm talking about lineages and variants. Example, Omicron. And as I said to you, I would say on the next slide, the sequence data that we're currently generating is telling us that it's all Omicron, of course, and the vast majority in Nevada is BA.5, with a few others occurring here and there, and very likely we'll continue to track and continue to see this organism change and this agent change. It's important to note that Omicron and BA.5 is a vaccine dodging strain, and also if you've had a previous infection with other variants, that doesn't provide very much protection against Omicron, so reinfections are quite on the rise. Of course, the booster for Omicron that's out there is looking to squash that problem, but we'll need a lot of time to look at the data on that. Some data to suggest, some hard data suggests that Omicron's less severe, but really we're in a complex dimension now because we treat COVID differently. We're medical operations are veterans at treating it, and so we have methods that we didn't have before. So there's confounding factors in saying it's less severe, but it does appear to be less severe. Another major outbreak a major update that everybody in Nevada should be aware of is that there is a large Candida auris outbreak in southern Nevada. According to CDC, which has come and investigated the case, it's the fastest outbreak to 100 cases seen in the US so far. It largely started in November of 2021. There were a couple of cases in August, but it continues now. But you can see it's relatively new, the introduction to Nevada. There's still not every state in the union, in the United States, has reported cases. We're now well over 480 cases across multiple sites in Nevada, and there have been 36 deaths. For those of you that don't know, Candida auris is a fungus. It's very inherently drug resistant, can be difficult to identify biochemically, capable of being identified genomically and by mass spectroscopy, but it's becoming a major healthcare associated infection. And as COVID has ruined the rest of everything about planet Earth, healthcare associated infections are all on the rise since our war with COVID was at its peak. And that may be for a lot of reasons, but hospitals were extremely stressed, healthcare facilities extremely stressed out, and so it really threw things off balance. And now we're starting to see a lot more hospital-acquired infections nationally. So this outbreak in Southern Nevada, here at the State Public Health Lab, we've been able to sequence the genomes of about half of these cases. It's telling us that the outbreak that we've seen here in Southern Nevada was really far more complicated than it appeared on the surface. If on the surface, it looks, there's an example where it looks like there were a lot of Candida auris all relatively at once late in 2021. When you start to sequence these cases genomically, the picture is that we had clade 1, which is a family of Candida auris that's genomically distinct. There's 5 genomic clades of Candida auris internationally. We had an institute in Southern Nevada that got hit with clade 1, as it looks like, back in late 2021. Genomically, however, it wasn't then an explosion of clade 1. There was a separate introduction, again, of Candida auris, clade 3, which is quite different genomically than clade 1. And then that started to spread in a particular institute in Southern Nevada. We also had a third introduction of clade 4. So you can see what looks like an outbreak was really 3 or 2, as I'll show you on the next slide. What then happens is that these cases either spread or did not. In the case of clade 4, that hit institution C, as I'll call it here, not going into names, this is a victory of luck or infection control, because clade 4 went nowhere. But clade 1 and clade 3 actually have had success spreading to other locations throughout Southern Nevada. So it's really become the meat of the pandemic, clade 1 and clade 3 spreading around. And this is an example of what genomics can provide us, is what we're looking at. Now, in response to this, the State Public Health Lab has started to offer PCR screening services, and this would allow for swabs right now. We're in the process of validating to accept specimens such as urine or blood, but right now we can only take swabs. Those would be human clinical swabs from anywhere on the body, or we'll take environmental specimens as well, because this is a fungus that has no trouble living in a sort of biofilm dimension and can be spread from environmental surfaces very readily. And so it's really important that we find out what environmental surfaces or fomites are contaminated with Candida auris. So this is a PCR, is a service to all of you, and it being here, as I'll go into when we get into the specimen transport part of this, I think you'll see that there may be advantages to utilizing this test in a manner with regard to turnaround time. Any specimen that we get that's PCR positive, we attempt to culture here. You can send specimens to us just to attempt culture. We are finding pretty good success. We see correlation on our PCR, so the high positive PCRs or moderately high PCRs are easy to culture. Some of the really borderline PCR positives, very difficult to culture. But when we culture them, that's when we can genomically analyze them and find out, is it a new introduction or part of the ongoing spread that we're seeing. Moving on away from Candida auris, a reminder that the carbapenem-resistant organisms remain a significant problem, and that by state regulation, the isolates, when they're accomplished, should be sent to the state lab. We can provide support for that transport. And if you have the susceptibility data, we would appreciate it, but we'll also perform that here to confirm it. We'll confirm mechanism of carbapenem resistance using both a phenomenological MSIM test and a genomic test in PCR. We also do the genomic analysis of these so that we can look at the relatedness of these carbapenem-resistant cases in Nevada. If you like, or if you have questions and want to know if a couple of your cases are related or not, we can provide that information on demand or upon request. And we can also start to train your staff how to interpret the data and how to look at the data that we generate genomically, so that as we move forward as a state, we can really start to harness and use this data and operationalize it in our infection control and our public health efforts. Want to work very closely with Kamisha and her team to try and get all of this out there over the next year. I think it's really important. One thing that we've done that lives in both a research but also a potentially practical realm is a study we've done with Merck here to look at the existence of resistance to an alternative. So one of the responses to carbapenem resistance, of course, is colistin, but colistin's not only the best choice to use in carbapenem-resistant cases. Another option is imipenem relebactam, which is a drug that Merck is now FDA cleared. It's commonly, in some areas being used now to treat carbapenem-resistant cases. Now, we were looking to see how much resistance there is in the community among the existing CREs to imipenem relebactam, and what we found in a study of 184 such isolates that were genomically sequenced and ascertained phenomenologically with regard to drug resistance is that about 2.4% of the isolates that are CRE out there right now were already resistant to IMI-REL, and about 2.9% were either resistant or intermediate. Were intermediate susceptibility to IMI-REL. So already some of the new responses that we're making to carbapenem resistance are being knocked back in at our feet. So moving now into more training aspects, but as I consider just an update for all of you about submitting specimens to the state lab, and as we'll get to some slides, Southern Nevada as well. I want to talk about how to get a specimen to us if you want any of the analyses that we've described or anything in our clinical menu. First concept to discuss is requisitions. So if you want to send something to the state lab, you need a specimen and the paper requisition right now, and we'll get to electronic in a bit, but you can use your requisition. Certainly we will accept that. Or you can use ours. Our preference is that you would use ours. You would let us know that you want to use ours. And what we will do is to go in and in the fields up here, hardwire this for your institution so that you don't have to fill out some of the information about your institution up here. And we would prefer being able to get those to you and to kind of control the distribution of our requisition, so that we don't know if we have a bunch of blank requisitions out there. We lack the ability to really control who sends us things. We want to make sure that legitimate agencies are sending us specimens. So we like to try and fill those in if we can. And we're happy to do that for you if you want to use our requisition. But certainly in a pinch or even regularly, you can use your own. And that would accompany the specimen. So if the test you want, if it's something you very specifically want, you don't see it on our requisition, or if you don't have it on your own requisition, feel free to write it in on a try to do so as clearly as possible, but write it in somewhere on the requisition to make it clear what it is that you want. We're not going to turn it away. If you didn't just check a box, that's not ever going to happen. So just remember, you can use yours or you can use ours. If you want to use ours, we'd like to engineer them for you specifically and get those to you, and then it accompanies the specimen. With regard to specimens, it's really beyond the scope of making slides to say what to send for everything that for which you want testing. But fortunately, we have a website which has collection instructions, and it's the same website I referred to earlier. It's easy to find through Google. So you can just Google the Nevada State Public Health Lab and you'll look at our clinical testing services over on the far right of that page. And you can get not only the tests that we perform, but you'll also see the specimen collection instructions. If it happens to be a category A or a category B organism or agent, we will, most of you are probably trained by our lab already, but if not, we're happy to provide that training free of charge. We can send somebody to do that, or we can provide it digitally. And we will do whatever we can to provide that packing and shipping training for category A as a service from the state lab. Now that you've got your specimens and you've got your requisitions, how do you get them to the state lab? Well, we do have a courier services, and I'm happy that I can use this as to provide an update with regard to that for you. We have different courier solutions depending on where you are in the state. In two modes, we have regularly scheduled pickups and we have what you might call on demand. All right, starting with Clark County, and you're going to hear more about that from William Bendick in a minute. But this would include Las Vegas, North Las Vegas, Henderson, Mesquite, and Pahrump. Our regularly scheduled pickups, we have a courier, the state lab has a courier that would go to the Southern Nevada Public Health Lab, the Southern Nevada TB Clinic, Valley Health Systems Core Lab, UMC, and Sunrise Hospital. If we go to the Southern Nevada Public Health Lab, note that the Southern Nevada Public Health Lab, and William will talk about their pickup in a minute, you have Quest Diagnostics, Dignity, North Vista, and VA Southern Nevada that they can serve. So if you're one of those places and you have things going to the Southern Nevada Public Health Lab, but it needs to go to the state, we can pick that up from the Southern Nevada Public Health Lab. The state public health lab can pick these up from there, or you can do the second mode, and that is you can call the Nevada State Public Health Lab. And if we're not on the regular courier list, you can call us and have a pickup arranged, and we'll send our courier out to wherever you need. If it's any kind of healthcare associated institute down there in Clark County, we'll send the courier out to pick it up. You can call the front desk or you can call the main number. I just gave you the front desk number here for the Nevada State Public Health Lab. Let us know what you need, where the address you need a pickup, and we'll send our courier out there in more of an on-demand mode. So there's what happens regularly, and then there's this option. If you're wondering how the courier gets them to us, there's a Southwest flight that leaves Las Vegas to Reno every day between 1 and 2 p.m. And that means that specimens will then get to us around 4:30 p.m. here at the state lab. And so therefore would get processed and tested, and depending on what that test is, turnaround may be the next day. But just kind of give you the behind the scenes on how those things get here, that's what we would be looking at. If you're outside of Clark County, anywhere else in Nevada, then the on-demand mode would work well for you. So any site out there that needs a pickup, we can send our courier service to get it. This would again require that you call us and let us know what you need. We'll make sure that our courier can come out and provide service to you with regard to that pickup. And courier transport, we have one other option that doesn't require the courier. We have a FedEx account, so if you need to send something our way, let us know, and we have an account number and instructions. We can help with regard to using FedEx to get those specimens to us if that's the most logical or best way for it to get here. For the FedEx option, most, if not all of the sites on the call, I imagine, are trained for Category A and Category B, packing and shipping. If not, again, as I said earlier, the state lab can provide that training free of charge. Please let us know. We're happy to do that. And now for the next few slides, I'm going to ask William, I think William Bendick of the Southern Nevada Public Health Laboratory would like to give an update from their laboratory to talk about specimen submission information regarding reportables and isolates. William?
Yeah, so thank you, Kamisha and Dr. Pandori, for allowing us for the opportunity to come in and speak a little bit on this. So if you want to go to the next slide, so submission of reportable disease specimens to our SNPHL, kind of going back to what Dr. Pandori was talking about, the two labs complement one another. We have similar testing services. Obviously, their menu is wider than ours, and it would be difficult to cover all the services here, but I'll go over some of it. So we have a requisition form similar to what Dr. Pandori had put up on the PowerPoint. You can call us at the number listed if you would like your facility to have a pre-populated either paper form. If you go to our website, which Dr. Pandori had mentioned, ours is also easily Googleable, but it's southernnevadahealthdistrict.org. And if you click under the programs, you can find SNPHL, and requisitions are available there as well. And if you just don't see what you're looking for, please call us and let us know, and we'll get that to you. And then we just have a reminder here that patient demographics are very important, so please make sure to include everything that's in the fields so that we can properly accession these samples in. And it helps if there are work cards related to those specimens, so microbiology workups or antibiotic resistance testing to be included with those submitted specimens will help with ID or further testing. And if you have any possible select agents, so the same organisms that Dr. Pandori had related to those BT organisms, we're also going to need a chain of custody form in case it does become something. And we need original plates for these. Sometimes laboratories like to wait for subcultures or do those things, but we prefer to have original plates and a notification as soon as possible. So when those Sentinel lab procedures trigger a response, we would prefer to have a phone call immediately, either to that 1020 number up above or to our BT phone, which is listed on our website. Oh, next slide, please. Okay, some other reminders regarding submission to us. We prefer for the organism to be on the appropriate media for the organism. And when we say appropriate, we just mean least selective and most least selective, freshest, and if possible, isolated, so not a mixed organism or a mixed subculture. For those fastidious organisms, you can use specialized media to help with the isolation of the organism. And again, if anyone has any questions regarding what is appropriate to submit, we're always available for those kinds of questions. And again, just like in the last slide, proper patient demographics, full name, date of birth, and information about collection, date, date of subculture, all of this information will help us with processing these samples. Transport in general is going to be room temperature for isolates and in an appropriate growth environment. So whether it be CO2 for some organisms or that sort of thing, but in a sealed biohazard bag and KP95 bag. And specimens should be received at SNPHL within 48 hours of subculture. So we really do need those to be as fresh as possible so we can begin work right away. Longer subcultures will require further workup and will delay turnaround time. So we have a reminder here about how to ship isolates, and I believe some of this information also potentially pertains to what NSPHL would like to see for Category A, Category B, but we have a diagram here of the original container, the rigid outer secondary container and then the outer box with, you know, these are specialized shipping containers, which NSPHL had indicated about shipping training, and that's all things that people would learn as part of that training, but an appropriate classified outer container to resist damage during shipping with all of the appropriate labeling that would go along with that category A or category B, as well as a shipper and receiver information, and then whether it's on dry ice or not. So the shipping is actually quite complicated, and it does involve specialized training in order to ensure that samples aren't rejected by FedEx or other carriers. So we have the possible select agent, and these other category A organisms have to be packaged according to DOT and other shipper carrier requirements in order to ensure delivery and for possible delays, as well as fines and other serious issues when these things are shipped inappropriately. And again, just as a reminder, you can contact us at the phone number, through our website, or anything for this type of information. And again, we partner with the NSPHL in many ways. So if ever anyone has any questions, can reach out to us or them regarding requisitions, tests that are conducted by either site. And there's the website that I had mentioned earlier. It is fairly Googleable. I searched it myself. It comes right up as the first one, and it has all of the information we've discussed here, as well as our testing menu, reportable disease menu, and information about how to reach us. And thank you again for your time.
Thank you very much, William. So I will pick up where the Nevada State Public Health Lab left off. So we've talked about requisitions, specimens, and then courier and transport. The last part, the last aspect to getting specimens submitted and tested would involve results and how you're going to get them. Right now, the Nevada State Public Health Lab will fax positive results to submitters. Negatives, certain institutions that want their negatives can get them. You could request them, and we would fax positives and negatives to you if upon request. Right now, we manually fax these, but we do have an auto fax function in our LIMS system, which we can set up for your site as soon as we can get that up and running. And I don't think it should be very long at all. And so if that's something that should probably make that when the result is generated and it's cleared, that it would get automatically faxed to you is a function that we want to get up and running, and we can work with you to do that. All results go out in the mail as well, just by regulation anyway. So you should get results mailed to you regardless, but fax would be the fastest way at the moment. Electronic reporting is coming and becoming very available. Obviously more, we do report, for example, electronically to places like CDC, and the technology is there. And as I'm going to talk about, the funding is now here for us to establish electronic reporting for hospitals in Nevada, located anywhere in Nevada. Unfortunately, the funding that we have to set up the electronic reporting, which we're working to set up, won't cover every single submitter in Nevada. So if you're a smaller site, not necessarily a hospital, an acute care hospital, fax would continue to be the way that you would get results, and that's why that auto fax function may be the best way for us to get results to you. With regard to the electronic interfacing, we're working with the Office of Statewide Initiatives and Rural Programs, because we do have a grant right now from CDC to fund the provision of data connections to sites throughout Nevada. And these would be two-way connections so that test results can be ordered and lab results would be sent to EMRs electronically. Obvious benefit of this would be a decrease in turnaround time for getting results, because there wouldn't be that brief delay that comes about from faxing. And with faxing, you can have other logistical problems. Someone actually has to pick it up and look at it instead of and then enter it into your system. So there's a lot of opportunities for error, as you can see in my orange comment there at the bottom. if we can use electronic, it will eventually be the best way, because we won't have so many people doing data entry at so many different steps, which is a source of error in diagnostic realm. And of course, in the world we live in, reduction of paper is critical, and that's another benefit of the electronic reporting. So with regard to the grant, this is a figure here that kind of describes what the vision was, and the vision that got funded for Nevada, and that we are currently now working with the Office of Statewide Initiatives to operationalize. The idea is that lab results generated there on the bottom at the state lab would by SFTP HL7 go into a transmission hub, that cloud in the middle. And from there, they would go right into hospital EMRs, so that providers such as yourself could go into the EMR to get those results. Now, those results from the EMR may or may not be then ported into a LIMS system on your end. This data connection, this funding that we have to establish these electronic connections, not only is a benefit to the state through the lens of ordering lab tests or getting lab test results, but it also includes our ability to set up trainings. We do have some hardware for this, so as I'll get into my next slide, for those of you that sign up to become part of this program, we do have the ability to offer like medical grade video tablets, so that we can use these connections not only to do data entry, test requisitions and resulting, but we can also use this to do things like trainings, for example, or consultations at a distance. This funding really encompasses all aspects of lab testing and public health lab functioning beyond just resulting and requisitioning. With regard to this electronic interface program and this grant-funded program that we're working on, what we have is an MOU, and I believe we've sent it out to most, if not all, of the hospital administrators and some lab people that we know in the state. But if you haven't got the MOU and you want to be a part of it, we can sign you up free of charge to get into this public health, we call this data exchange program, where we can start to work on establishing these HL7 connections. The MOU, as I said, has gone out to many already, but if you're not aware of it, email me or call me. I'm very easy to find. You can Google me. I'm mpandori@unr.edu, or you can call that number that's been on the screen a million times, call it and just ask for me, and then I can get the MOU out to you, and you can sign up so that you can get on the list, so that we can start to get these electronic data connections set up. If you're interested, and that would allow a two-way connection, so that you eventually be able to order lab tests electronically, but then get your results electronically. The last part of the talk I wanted to talk about was just a few upcoming items from the public health bin. We have a new satellite state lab going up in Churchill County. It'll start out with limited services, but SARS-CoV-2, but it will slowly expand. So this is in addition to the statewide public health network that we're trying to build. Again, we're working now to expand the genomic analysis to include mycobacterial isolates. There's a big win hiding there, because if we can start to use these genomic tools that I've talked about for tuberculosis, you not only get the disease control aspect to it, but this is one of the organisms in public health and in medical science where we trust genomics to ascertain drug susceptibility. So if we can do this and do it well, we should be able to reduce the turnaround time, so that waiting for drug susceptibility data on cases wouldn't be quite as long if we can get that information out of the genomics. And we're working to try and get that program up and running. CDC has made a lot of headway on helping labs with that, and we look to harness that when we can, because our genomic infrastructure is already there. Again, as I said earlier, our reference lab's bacterial identification system includes biochems and mass spectroscopy, but we are now validated to use whole genome sequencing to do those identifications. So if there's a weird organism or a very difficult to ascertain organism, a reminder now that we can do genomics, and that's gonna develop further. We use a curated database to do that. We don't use the junk out on the internet that isn't curated. It's a database that uses high quality sequences only to make these IDs. So it's something we looked at very carefully through a CLIA lens and a quality lens, and want to share that with the community in Nevada. We are bringing on CRS susceptibility testing, and the promise to me is that this will be up and running by January 1st, 2023. The equipment's on its way, and we have a lot of isolates from this outbreak to do validation studies. So it shouldn't take too long once we get the equipment to be able to provide this susceptibility testing locally. So if you're sending those out, I think in 2023, it's a guarantee we'll be able to provide that locally. This may not be of much interest to everybody, but just so you know, we're moving from StarLIMS version 10 to version 12. Our SARS-CoV-2 is sitting on a version 12 of StarLIMS. Well, we're looking to bring all of our tests over to the new version of StarLIMS in the near future. And then a long-term thing, we are funded to get a new state lab here in Reno, a new building, a bigger building, which hopefully will allow us to expand services further and create efficiencies. And we're looking for late 2025, 2026 for that to be completed. A reminder, I hold monthly office hours and give talks monthly now, the final Thursdays of every month at 1:30 p.m. So if you ever want to pop onto those calls and we can have an open discussion about anything where the Nevada State Public Health Lab may be of service to you and your operations, there will be this Thursday a such meeting, and please, that was circulated pretty broadly. If you may already have the link, but if you need it, feel free to email me at mpandori@unr.edu, and I can get you the link. That's mpandori, Pandori, @unr.edu, or you can call the lab, and I can get you the link. I can just send it to you, and or Kamisha, I can maybe circulate it through your email list, and you can attend those or not. They're open office hours, so to speak, every last Thursday of every month. I want to thank you all for the opportunity to provide this update and training, and Kamisha, I'll hand it back to you.
Awesome. Thank you, Dr. Pandori. Thank you, William, for your presentation. There was one question. It says, what test can Pahrump send to Clark if we are, someone says if we're able to send for a Courier?
You want to send to the Southern Nevada Public Health Lab or the State Public Health Lab? What,
Eugenie Walker, if you're able to come off mute, so you can clarify which lab you're trying to send to.
For the state lab, it would be a matter of calling the 775-682-6200. We would get an address, and then we would have our courier come out and pick that up, get it to the airport in Las Vegas so that it would fly up to Reno by 1600 hours Pacific time, and then we would get it into our testing queue. If it's for Southern Nevada, I'll leave that to William.
I don't know if Jeannie's on the call. This is Tanya Licio. And this is one of our clinics, our rural clinics out in Pahrump. So typically our understanding is that we need to send our specimens to the state lab. So that's good information. If we can call that number and arrange for a courier to get it on the plane, I think that'll meet our needs.
Okay.
I was finally able to get off mute. What we were looking at was if we could deliver it to one of those sites, to have it picked up by courier, but if we can call and have it picked up, because sometimes we do have things that are time sensitive.
Yes. I hope you got that one. It's 775-682-6200, and if it's something that can go to Southern Nevada, it sounds like they can get you to. But that courier will get it to the airport, and that plane leaves. I wrote between 1 and 2 because it was a 1 o'clock flight, but Southwest has been moving these around a little bit. It's between 1 and 2.
Dr. Pandori, what was the number again?
775-682-6200.
Thanks. And then some have asked, am I able to share these slides for those
Yes.
who've attended? Okay. So if you guys could email me or just email me this presentation and then I'll send it out
Yeah,
to
you
those
know-
who participated.
I could share I'm still sharing, right?
Well, no, you
So-
have to email them to me.
Here, let me, I can give everybody my personal email and on this slide here, do you see, thank you? Misha?
Yes, yes.
So my email address is there. It's either med.unr.edu or you can just do unr.edu. Either one works. And then that's the phone number to my office. So if you don't get service at 6200, just call me. And I'm in my office a lot. Just call me and I'll make sure you get service.
All right, now I have your email address in the chat as well as mine, and I put the
Yeah.
phone, the 6200 in the chat for people to get that down. And we have some people that are on the phone, so they can't see the chat. So that's why I was asking
Okay,
for the
I'm
slides,
sorry.
so we can just email those out as a PDF and they can
That was
access
thoughtless
the
of
links
me,
and
sorry.
no problem. If there are no more questions, we will go ahead and end. As I mentioned, we will get this recording posted to our website as soon as possible. And I did send the link to our website out when I sent the calendar, the information for the training. So you have that link in that email. But thank you all for participating. Thank you again, Dr. Pandori and William, for the information. It's well appreciated, and you all have a great day.
Thank you. Thank you, everybody.